welcome to our channel. I'm Lai. Last time we explained how the pandemic broke out and what happened to the daughter Li Wenliang and social distancing. If you want a more detailed to understanding, you can check on Wikipedia. I'm going to share with you an article by Nina White in the news and media section of the University of California, San Francisco shows one category of evidence comes from laboratory study of respiratory droplets and the ability of virus masks to block them. An experiment using high-speed video found the hundreds of droplets ranging from 20 to 500 micrometers were generated when saying a simple phrase. One day nearly all these droplets were blocked when the mouth was covered by a damp washcloth. Another study of people who had influenza of the common cold found that wearing a surgical mask significantly reduced the amount of this respiratory virus emitted in droplets and aerosols. Because it would be normal to assign people to not wear a mask during a pandemic, the epidemiological evidence has come from so-called experience of nature. A recent study published in Health Affairs, for example, compared the COVID-19 growth rate before and after mask mandates in 15 states and the District of Columbia. It found the mask mandates lead to a slowdown in daily COVID-19 growth rate, which become more apparent over time. The first time 5 days after a mandate, the daily growth rate slowed by 0.9 percentage points compared to the 5 days period to the mandate. At 3 weeks, the daily growth rate had slowed by 2 percentage points. And other studies looked at coronavirus deaths across 198 countries and found that those with cultural norms or government policies favoring mask wearing had low death rate. If we were practicing social distancing, we still need to wear masks because there is a lot of evidence of transmission through inhaled droplets. About the vaccination, many people, they afraid to get vaccine. I think if you are in place where the pandemic is not serious, you can delay the vaccination if you want. And if the epidemic situation in your area is very serious, so it's best to choose to get a vaccine. We often see news that some people died after being vaccinated. Although there's a lack of data, there is no doubt that more people died for COVID-19 than those who died of side effects after vaccination. Guys, after actually, I've take the vaccine, and I feel terrific. Yeah, yeah. As we mentioned before, uh, the coronavirus was break out from Wuhan, but the prevention and the control measures taken by China after the outbreak of the epidemic are very effective, such as compulsory isolation of patients and foreigners and compulsory wearing of masks. Maybe your country, does not have a strong execution or their harsh government, uh, but you live in a right-wing country, means you are free. But if everyone consciously maintains social distance, wearing mask and the vaccine, the infection rate can also be kept at a low level. You know, I think um, this is all from today, and I can show you our reference. You know, this is the essay that we referred. I think this is all, guys. And thank you, and have a good day, and hope you are all doing well. Also, stay safety. Yeah, thank you, guys.